Hey, welcome to Resilience Radio, episode 14 with Hannah Rohloff, cancer massage therapist and lymphatic drainage practitioner. Who am I? I'm Irvin Eisenberg, owner of Resilience Occupational Therapy and the show host. The opinions on this show are not necessarily shared by me. I like to really feature a variety of different perspectives. Additionally, it's not meant to be medically diagnostic or prescriptive in any way. Today's guest is Hannah Rohloff. She's a board-certified therapeutic massage therapy and body worker who specializes in oncology massage and manual lymph drainage. It's great to have you on today, Hannah.
Hi, thanks for having me.
So, some people might not know that the two of us shared a clinic room at one point, and I often referred to it as the under-recognized tissues room, due to you working with lymph and me working with fascia. People have heard me talk about fascia here and there. So, if you could just start off explaining what the lymph system is and why we should care.
Yeah, so I'll try to keep it simple and succinct, which is always difficult when I talk about lymph. The lymphatic system is pervasive to your body. It sort of mirrors the circulatory system and has a lot of different functions. The primary function that most people are aware of is it has some immune function, as well as moving waste products, excess fluid, things that leave the bloodstream and are not taken back up into the circulatory system are picked up by the lymphatic system in the subcutaneous fat layer and then carried through lymph nodes where it's filtered. And in the lymph nodes, you would have immune response if there was something foreign in the fluid that was moving through those lymph nodes. And then eventually it makes its way all the way back up to the neck where it empties into the circulatory system again at the venous angles, right where the blood re-enters the heart. And so then it becomes part of the bloodstream again.
So, people often know about arteries and veins. Why is lymph so often glossed over in anatomy education?
Well, it's one of those things that when you cut, when you get a cut, you can usually see blood welling out. And so people tend to be aware of their circulatory system. You can also feel your heart beating. You don't have that central organ with the lymphatic system. And when you cut yourself, you don't see lymphatic vessels. So it's easily overlooked. And it's really only recently that they've gotten some good diagnostic and imaging capacity of the lymphatic system, but it still involves injecting a dye into the body, which is then taken up by the lymphatics. So it's still not the easiest system to easily see, and you don't generally see it with the naked eye, superficially at least.
Okay, so I think we'll probably talk more about lymph as we go along here, but I wanted to back up a little bit and have you talk a little bit about the philosophy of your work and what types of clients you see.
Yeah, so I don't know if I have a central guiding philosophy other than that every body deserves touch and everybody should feel safe on a massage table, which I think and hope most body workers share that same philosophy with me. I really enjoy working with folks who um, have more fragile systems, I guess would be the term, although I hate to term somebody anything. But I often work with people with many different health conditions who might not go and get a traditional sports massage or spa massage, might feel a little uncomfortable or like that massage modality might not be safe for them. So I enjoy working with those people who still want to receive body work, but might need more modifications and care taken.
Okay. So I think you had mentioned sort of three overarching, and I might have this wrong, types of populations you work with: people who have lymphatic challenges, not fully intact lymphatic systems, cancer patients, be past or present, and then I think you had also mentioned gender-affirming surgeries being something that you've worked with. Um,
Yeah, I think that pretty much captures most of my population. Um, one has led to the other, which has led to the other. I started actually right out of massage school working with cancer patients. That was really where I felt drawn to work. And then once I began working with cancer patients, many of those clients have had surgeries that have impacted the lymphatic system. Radiation impacts the lymphatic system. as you know, many people end up with some really interesting scars that not only impact musculoskeletal systems and fascial layers, but also impact the lymphatic system. And so then I got fascinated in learning about the lymphatic system and added that training on. And then in my work with people pre and post surgeries, I've been honored to do some work with people in the trans and gender nonconforming communities as well, providing some support pre and post surgeries, most often top surgery or modified subcutaneous
And
mastectomies.
does that most directly relate to when you're talking about um, the gender affirming surgeries being related to the lymphatic system when you do work, or what do you tend to focus on when you're working with that population?
I mean, I tend to schedule as a lymphatic session, but it's sort of a mashup of many of my hands-on skills. So there's always a lot of fluid swelling post-surgery. So moving that fluid out using lymphatic techniques. I also tend to work on scars relatively early, just using lymphatic techniques since they're so gentle. And you can often work surrounding areas without impacting a fragile scar or a healing surgical site. And then as folks heal more, then I'll move into more scar work, more focused scar work, and some body work as well. So it's kind of it's a mashup. I often schedule it as a lymphatic session and then throw a lot of different techniques at it as I'm
So
working.
you've got your lymphatic drainage toolbox that you draw from, and you made reference to other techniques. What could you give an overview of the techniques that you perform?
I would never underestimate the beauty of a simple Swedish massage stroke for soothing the nervous system and really helping people settle and calm. So I always, I do a lot of gentle massage in all of my sessions. That's the foundation. That's where I started. I've had people say to me, "Oh, once you finish your lymph training, you'll never go back to massage." I'm like, I would never stop doing massage. Like, it's such a beautiful blend. And then, of course, the lymph training. And I've trained now with 3 different schools of lymphatic studies, which is a gentle technique. And then also some scar work, which I've trained in mostly with folks who work in the cancer community. But it's obviously applicable to all scar tissue. Trying to think if I throw any other modalities. Not
Okay.
really.
And I think it's worth guests knowing that while occupational therapists sometimes specialize in lymphatic work, I personally do not have that training. I feel comfortable doing some very basic um, lymphatic stuff, but I do not profess to do that. So, in case there's any confusion between our two skill sets there. Um, so, what is how does the cancer massage? Is it just that it's tends to be lighter? How does cancer massage differ from lymphatic? Or I guess what are your offerings at your clinic?
Yeah. So if you said to someone who has trained in manual lymph drainage, or the other school I've studied with says lymph drainage because the instructor is French, but I say lymph drainage. If you said to someone, "Oh, so you do lymph massage," some of them would get offended at the use of the word massage, because to them it's a very different technique. Lymph drainage tends to be very gentle because you're working the superficial lymphatic capillaries in the superficial fat layer. And so it's a sort of a gentle, repetitive stretching um, technique, if that makes sense, that you do sort of along very specific anatomic pathways and then modify based on if people have had lymph nodes removed or irradiated, if they have scars that are in the way of the lymphatic drainage. So it's different from massage in that it's, there is an art to it for sure, but you start with sort of learning these very fundamental strokes and positions of fluid drainage that is just very scientific. That's not really the word I want to use. It's very anatomic. That's the word I want to use. Because it's not necessarily always scientific, but it is very anatomic in that you learn where the lymphatic system is in most people and what variations people might have, and then you work along that. So the lymphatic massage or the cancer massage differs in that yes, it's often just gentle massage. but it's the amount of training that you generally take before you start touching folks who are more fragile that I think makes the difference. So I went through a basic massage program, and then went on to train with some people who specialize in teaching oncology massage. So you spend a lot of time learning about different surgeries for massage treatment, the impacts of radiation on bodies and tissue and how that changes, how lymph node removal or lymph node biopsy affects the lymphatic system in the body. So you take all of that knowledge and then you add on someone's medications, someone's treatments that they may have had recently, and modify the session to work with them as safely as possible. So that may mean that, they're on their side positioned with many, many pillows so that their portacath isn't impacted by the body work. And maybe that, their platelets are low, but they're okayed by their physician to receive massage, but it's going to be very gentle because their platelet count is low and you don't want to cause bruising. Um, or they've got some foot swelling, but the foot swelling is a side effect of one of the medications they're on, and they're well managed by their oncologist. So you can do some gentle work on their feet. So it's just more taking, all of this knowledge and training in all of the side effects and impacts that cancer treatment have on people and that cancer itself has on the body, and then trying to provide a session that still feels like massage so that people aren't laying on the table thinking, oh, they're doing that because of this part of my health history, but they're just able to relax onto the table and think, oh, how lovely, I'm getting a massage just like I have always received massage.
And two things come to mind. One is I was thinking about or reflecting on my tendency to say lymphatic massage instead of drainage, and I think it's the it's not out of any disrespect to the profession, but I feel like some people, when they hear the term lymphatic drainage, there's this image of something being drained from the body and being a unpleasant procedure, whereas massage sort of gives it that is in many ways I feel like more descriptive, if in that sense. Um, but with that, the other thing that I'm wanted to have you speak to is I've definitely talked to people who just firmly get scared with the idea of massage for anyone who has active cancer, and the idea, well, cancer is this uncontrolled growth in the body, and we don't want to be spreading it, and you're doing a terrible thing if you're doing any sort of massage for someone with cancer. So how do you respond to those fears?
Well, I mean, certainly that was what used to be taught in massage school was don't touch people with cancer because you'll spread the cancer. And most of the sort of pioneers of oncology massage came out of that training where they also were coming from more of a science or healthcare related background. And so they were sort of like, okay, I'm a researcher. I have a clinical mindset. Is that true? Is that really true that if I massage someone, I'm going to spread their cancer? And so those were some of the early pioneers who started to explore this and find ways of safely managing. My thing would be if massage spread cancer simply because it's circulatory, possibly that's also up for debate. But if massage spread cancer, then those folks would also be told don't take hot showers, don't exercise, don't engage in anything that increases your heart rate, don't move, because all of those things are also having an impact on the body that if we thought it was as simple as spreading cancer just by movement, then those things would also be contraindicated. And as we know, most people are advised to exercise during cancer treatment and to stay active if they're able to, and to do things that bring them comfort. So, there's been some good research and safe practices developed around oncology massage. It's not just like it's totally safe to receive massage and everyone should get a massage and go to any massage therapist while you're going through cancer treatment. It's not that simple. But I think that they have done a good job of disproving that simple premise of massage spreads cancer, because cancer is a far more complicated mechanism in the body that happens on a much smaller molecular level than simply massage. And it's discrediting the many, many varieties of pressure and movement and positioning that we can do in a massage to make it as safe and gentle as necessary for that person.
So are there types of cancer that massage would just be sort of a straight up contraindication?
No, I don't think so. I mean, certainly if someone's in such fragile health that they're hospitalized, or their platelet count is so extremely low that any touch causes bruising, or if their immune system is so compromised that they shouldn't be in the presence of others, that might be a contraindication, but it's going to be a contraindication for most things. I would say that most cancers do not necessarily. Um, I would say that most people going through cancer treatment or living with cancer can receive
Mhm.
massage with modification.
Okay. So you tend to work with these sort of very select populations. You don't tend to take on new clients that are just straight up relaxation massage or therapeutic massage. Is that correct?
Yeah, and I hate to I really was reluctant to close my practice at the beginning, but there's only so many hours in my workday, and especially with COVID, I'm not working as many days in the office as I was before, since we're restricting our office use to only one practitioner in it at a time. And so I really needed to just hone down on the populations that I'm really passionate about working with, as well as using the specialized skills that I've studied. I love giving relaxation massage. I have many clients that I've been seeing for years that still see me for regular massage. But for new clients coming in, I needed to sort of narrow it down so that I was filtering out people who were just wanted a deep tissue massage or some recovery after heavy exercise.
So for someone who doesn't have cancer that they know of, but is intrigued by the lymphatic work, or doesn't, under what circumstances might someone seek your services, um, as a lymphatic drainage practitioner?
Well, I get referrals from a lot of other healthcare practitioners in the area. And so sometimes it's just someone's had a routine surgical procedure and has some residual swelling that's not responding to treatment, or everything's been ruled out basically, that's of deep concern to the doctor. And so they will sometimes refer them just to try a little fluid movement and see if it's helpful. I certainly have done a lot of work with folks with autoimmune conditions, and those going through Lyme disease treatment who have sort of persistent lymph node enlargement. Um, yeah, and I have a few clients that just come to me for some like general lymphatic full body clearing. Um, I mean, if nothing else, it's incredibly relaxing. It's very gentle and it's very repetitive, and people tend to either zone out or fall asleep on the table. So I think for many people where other forms of body work might have been uncomfortable in the past, it's a really nice way to sink into deep nervous system relaxation.
No, but my personal experience with your work, I have received a few times from you, and I have an intact lymphatic system, so it was as much just trying to figure out what it is you were doing, which is not as applicable, I think. But it was interesting for me to discover that some of the flow, like around my knees and such, and knees and back, weren't going the most efficient direction. And I felt like you were like the way you're describing, almost like rerouting streams back into the right channels, kind of thing. Additionally, I felt like occasionally, and this didn't happen every session, I'd have this sensation of like warm honey is the best description I can have of like just that fatty layer or just below the skin. I would get this like warm flush, and it didn't happen most of the time, but when I'd have it, it became like this full body, nice kind of neat experience. How typical is that? And like, I mean, I'm experiencing this from a intact lymphatic system, which is not your typical client.
Yeah, I feel like people experience different things, and I never tell people what to expect going into it, because I think if I plant a suggestion in someone's head, oh, you may feel movement or flow, then they'll probably feel some movement or a flow. But afterwards, people do often report sensation, a trickling sensation or a sort of warm, comfortable, like buzzing sensation. Um, and oftentimes not in the area I'm working. I may be opening at the neck and clearing at the end point of the lymphatic system. And because there's a little bit of a vacuum through the entire lymphatic system, they'll be like, oh, wow, like that feels amazing in my leg.
Hmm. So are there people who you feel like might benefit from lymphatic drainage work who don't know that they might benefit from it? And what would be their what would be the signs that somebody listening to this um, might want to consider this when it wasn't part of they're not having any major surgery, and they're not struggling with any autoimmune or cancer challenges?
Oh, that's a hard that's a hard question to answer, because I feel like people tend to be sort of like, oh, I just have really been interested in this modality and I felt really like I should try it, or oh, I've never heard of lymphatic drainage, but my acupuncturist thinks it would be helpful. So I don't really know if, I mean, in general, the lymphatic system really does a beautiful job of self-regulating. In general, our bodies do a really lovely job of detoxifying and moving fluid. And, it's incredible what happens on the cellular level at all times in our bodies. So I don't feel like, people are sitting there listening to this podcast thinking, oh my gosh, my lymphatic system, I've completely been ignoring it for years, the poor thing. I think if you're moving, if you have a movement practice and a breathing practice, you're doing some good lymphatic support already. So, I would say if it's intriguing to you, then maybe check it out. But don't come see me because I won't be able to accept you as a new client.
Okay, well, I always appreciate good boundaries. um, so we started off talking, sort of jumping straight into the lymphatic system, and sort of we've been jumping around quite a bit here in my questions. But you were talking about how light how light the touch needs to be, and I'm not sure if I understand this exactly correctly, but I guess it's the more superficial lymphatic vessels that by actually pushing more than I've heard a dime's pressure, which seems like not very much, um, that you're actually squishing the lymphatic vessels and not being able to give the flow. Could you speak to that?
Well, the idea is, I mean, this is the way I was taught. And, I'm going to be completely honest in that as they find better ways to image the lymphatics and as they find better ways to inject dye into people and then work on the lymphatic systems and see what pressures are really necessary to move fluid, this is a changing modality and a changing field. So, this is, I can speak to what I've been taught, but I attend continuing education multiple times a year. And it's like really fascinating some of the research that's coming out. So that's my little disclaimer that, like all body work, it's constantly in flux what's being taught behind it. But the basic premise is that the superficial lymphatic systems are single cell walls, and they have these little anchoring filaments that come out from the cell walls and connect into the superficial fat layer tissue. And so when you create a gentle stretch on the skin, you actually opening, stretching against those filaments, opening the cell wall and allowing fluid to enter into the lymphatic system. So that's why the touch is so gentle. If you're pushing deeper, working into the muscular layer, it's thought that you probably are just pausing the lymphatic system, but also a concern that if someone had a non-intact or a fragile lymphatic system, that you could actually damage lymphatics by working too deeply and aggressively. Certainly there are deeper techniques that are done to target lymph nodes, and to target some abdominal work. But in general, most of the superficial lymphatics are accessed with that sort of gentle stretch, is how I would think of it. In much the same way that when someone's wearing compression, they're getting that compression on the outside of the limb that's helping return fluid into the lymphatic vessels, sort of continuously doing what I'm doing in real time with my hands when I'm doing a lymph session with someone. And it's a fluid system. So, you can't, like, if someone comes to me with a large amount of fluid that their doctor would like to have worked on, and we return it into the lymphatic system and the circulatory system, and then they don't wear compression or they don't do something else, some other form of self-care, the fluid is just going to keep returning. So it's definitely one of those things that works best in combination with self-care and compression. And I certainly refer people often to PTs and OTs who are trained in that if that's something that they need.
So your training is specifically in the manual therapy um, portion of lymphatic drainage. Is there separate training that you don't have in the compression work?
Yeah, so the sort of the gold standard, and I'm speaking of lymphedema treatment, which would be for someone who's been diagnosed with lymphedema, which is a protein-rich edema. But the gold standard is complete decongestive therapy, which is manual lymph drainage, followed then by remedial exercises, bandaging, and compression. And I am not trained in the remedial exercises or the compression, simply because I can't bill insurance for it. And so I originally took my lymph drainage training thinking, oh, I'll go on and I'll do the complete and become a complete decongestive therapist. But I can't bill insurance for it, and it's very expensive. So it's easier to just refer people to their PTs or OTs if I feel that's something they need, and then they'll come back to see me once they've been discharged and maybe just need some maintenance MLD. They'll
Okay.
come see me.
MLD being manual lymph drainage. Yes.
Manual lymph
Okay.
drainage, yes, exactly.
So it's been great talking with you. Do you have any closing thoughts you want to make sure people hear, or things about the lymphatic system or massage that you'd like to close us off with?
I think just to encourage people that to seek out, these sort of specialized forms of body work if you are going through a difficult health journey. I think many people are overwhelmed when they're faced with a cancer diagnosis or have just completed extensive surgery. But I do really feel like I see a huge benefit in my clients who are able to receive that, as well as improved healing and oftentimes regain range of motion and function and return to sort of normal everyday activities more quickly if that's something folks are able to do. I do realize that because massage is not generally covered by insurance, that finances can be a challenge. So I do want to encourage people. I have a scholarship fund that I offer to my clients who can't afford to pay full price for services. I know that CVMC has a fund that they can cover some body work and other complementary therapies for their patients. And there's other opportunities out there if finances are absolutely a hindrance to receiving this for people.
Well, thank you so much for coming on today. It was really great talking with you.
Thank you so much, Irvin.
That was Hannah Rohloff speaking to us today about cancer massage and lymphatic drainage. It was really great talking with her. If you enjoyed this episode, you can subscribe to the show, Resilience Radio, and get podcasts every week, a new interview and with a different practitioner or researcher. And if you could also leave a review on the podcatcher of your choice, that would really help out. You've been listening to Resilience Radio. I hope you enjoyed.